Thanks very much. Well, thank you to the organisers for asking me to come and speak what is about, a talk really about advocacy and lobbying and some of the experience that I've had in my various roles as an AMA president, but in other government roles as well. The government really does two things. It makes laws, it passes legislation, but it also, of course, raises taxes and spends that on its programs. And one of its major programs, of course, is funding health. And whatever we do as advocates, as doctors, really is designed to try and influence either the expenditure part or the legislative part. And as doctors, we have a very strong voice, as you've already heard today. And part of that comes from the fact that we engage in a very broad aspect in terms of the community, and we have a great amount of experience in things that other people are never likely to see. We know a lot about what happens in people's lives. But also we are still held in high regard by society, and so politicians have to listen to what doctors have to say. So I thought I'd try and distill it down to really 5 Ps in terms of what I thought were good pieces of advice for people who are wanting to be advocates. And the first one is to be present. So I can still remember the moment. It was a Saturday afternoon when I was driving home from the Children's Hospital. I'd been on call for the adults and kids, and we'd had a spate of terrible accidents, and we'd had several children die at the hospital. One was a boy with an atlanto-occipital dislocation, and I can still remember him being resuscitated in the CT scan room. I was about to go upstairs and take out the subdural of his little brother. In the CT room were the parents, and they were absolutely grief-stricken. And part of their grief was obviously in relation to what was happening to their children, but it was amplified by the fact that the father had been the one that had caused the accident. And so, on driving home after that afternoon, I was reflecting on this and I thought, okay, I have to really try and do something about it. And that was the moment for me that it became not just about the patient in front of me, but about the patients that came afterwards and about preventing people from becoming patients at all. So I was working with the government on something very boring, an administrative thing about setting up hospital boards. And so I talked to the Chief of Staff of the Minister about my experience and what we could do. And within a week, I was in front of the Minister for Roads, the Centre for Road Safety and the department, and in 6 weeks we had the Don't Rush campaign, which is one of the most successful campaigns that's been run here in New South Wales about preventing road injuries and, of course, death. And that happened not because they came and sought me out, but because I was there, I was present. And I think I see this happen all of the time. I mean, people put submissions in, they wonder why nothing happens. But the people that are engaged in committees and working in the department, their voices do get heard. And there's nothing underhanded about it. It's just a matter of they're present. And the second thing I was going to say was platform. Second piece, platform. Now, I was there in a role as being a chair of a committee as part of the AMA. Now, whether you agree with all of the things that the AMA, your college or special interest group has to say, having a platform gives you two things. It gives you legitimacy and it gives you opportunity and access. So I would strongly encourage you to consider taking on those sorts of roles if you want to be an advocate. Third is patience and persistence. So not everything happens straight away. That Don't Rush campaign took 6 weeks. It was extraordinary. But I've had other projects that have taken more than 10 years. So when I wanted to establish a shunt registry here in Australia and copy what was happening in the UK, it took me 10 years to get that established. And so being patient, being persistent, working with the political and economic cycles is sometimes really important. Fourth one is a passionate narrative for change, and you've heard a bit about that today. So I started an op-ed that I wrote when we had a spate of children falling out of windows here in Sydney with something like, when Muhammad fell from the window, he could see the ground rushing up towards him, and I know this because he broke both wrists. And as his head hit the pavement, the hopes and dreams of Muhammad and his parents disappeared with him. Building a passionate narrative gets the attention of the politicians, but also the media. It got to the point where on a Sunday afternoon I was sitting in my car listening to the radio and I heard about another case of a child who'd fallen from a window. That was concerning for two reasons. First, obviously for the child, but second, I was the neurosurgeon that was on call at the Children's Hospital and I hadn't heard about the case. And of course, the media were reporting this before my registrar could even see the patient and give me a call, because they were onto this as a narrative, as a problem that needed to be solved. So when we formed our alliance with architect organisations, building organisations, and we went to the minister to change some of the strata laws to try and prevent this from happening, we had that passionate narrative for change. And I think that is one of the most important and strongest things that you can do when you're being an advocate. And it takes time, and you've got to be smart about the way that you do it. The final one is really about talking to politicians. I had various roles, obviously, as an AMA president here in Australia, but also as a chair of a ministerial advisory panel for voluntary assisted dying in Victoria in 2017. And my role was to take a rough framework of proposed legislation, consult with the community, with stakeholders, develop the policy, the drafting instructions for the legislation, review the legislation, make sure it was consistent, and then brief not only government members, but of course members of the opposition and cross parties as well, and assist that law to pass the parliament. So I've spent many nights with talking to politicians about how they engage with the community, because this was a conscience vote and it was one of the most difficult decisions that many of them had ever had to make. And I'd say there's a few things. First of all, when you're engaging with politics and politicians, and particularly with government, engage across the spectrum. So, talk to not only the minister, the local members, the assistant ministers, and the shadows. Don't forget about the opposition, and even the government departments. Make sure you're broad in your level of contact. When you get a meeting with a minister or a politician, manage your time effectively. As they say, don't bury the lead. Make sure you get your point across within the first 60 seconds, because if the bells ring on the clock and they have to go off and vote in the chamber, they might not come back again, and it won't be able to be rescheduled for that day. So make sure you get your point across quickly. Only take 2 people, maybe 3, because everyone knows what they need to say, and if you start having someone dominating the conversation and taking it off in another direction, you're going to be in trouble. When you meet with a politician, make sure that you exchange details with their advisors. They'll always have an advisor in the meeting, and they will be your point of contact. Don't provide them with a great tome of information carefully researched. Give them a 2-pager and offer them more information should they request it. I think one of the most important things, though, when you're going to meet with politicians and you're trying to push your case, is to get to know them or know about them before you actually have the meeting. And one of the things with the voluntary assisted dying legislation in that 107 hours of debate in the Parliament was that you start to realise, the rich amount of experience that these people have, just like everyone else in the community. And that often shapes their views. They'll often have personal connections with either friends, family, or even constituents that have had a certain problem, a disease or an illness or a trauma that will actually shape their thinking as well. So try and get that personal connection as much as possible. I'm looking forward to the panel discussion, so the only thing really left for me to say is that I wish you the very best of luck in your efforts, not only in dealing with the patient that's in front of you, but of course those that come afterwards, and preventing people from becoming your patients at all. Thank you.